With the latest proposal by President Obama to offer free community college to all Americans, the ever-expanding list of entitlements served up by the federal government would grow even longer. This is hardly surprising. The clearly enunciated goal of progressives has long been perpetual expansion of the welfare state to cover Americans from the cradle to the grave. Medicaid guarantees medical care to the poor. Medicare guarantees health care to the elderly. Social Security guarantees income to the elderly. Obamacare guarantees health insurance to everyone. Unemployment insurance guarantees a safety net to people who've lost their jobs. And there's many more federal guarantees: food stamps, housing assistance, the child nutrition program, low-income home energy assistance, disability insurance. And the president's latest proposal, though politically dead on arrival in Congress, would guarantee a free college education. As famously stated by James Madison in Federalist Paper number 51, if men were angels, no government would be necessary. Madison therefore defines government as it was always intended in this constitutional republic, as a necessity, not a driver of people's lives. The question about these entitlement programs has never really been whether people who, for various reasons, are unable to help themselves are worthy of receiving help from the government. It's about how many of those receiving the help truly need it, as the astronomical costs of these programs have now left us in a deep hole. $18 trillion in debt and $100 trillion in Medicare commitments alone going forward we have no way to pay. Senator Rand Paul hit at the heart of the problem recently.
All of these programs, there's always somebody who's deserving, but everybody in this room knows somebody who's gaming the system. We all know people who are horrifically disabled and can't work. But if you have able-bodied people taking the money, then there's not enough money left for the people who are truly disabled.
We need to be mindful of the reality that more government ultimately means less freedom for you. It means less money because the government is swallowing up more and more of it. It means less choice because the federal government has a monopoly on the growing number of services they provide. And it means less incentives for people to solve their own problems and take control of their own lives. Entitlement programs were developed to fix problems, but in most cases they either don't fix the problem or make it worse by forcing all Americans to turn over more and more of their hard-earned money, necessitating two incomes in most households just to get by. And if they can't get by, the government steps in and furthers this cycle of dependence. The war on poverty, launched 60 years ago, has been a failure, with the poverty rate today virtually identical to when that war started, because a government check cannot fix the problems that cause poverty in the first place. Good policy must be dictated by how it serves the great majority of the American people, then adjusted to account for those on the fringes, not the other way around. Obamacare is Exhibit A in the progressive approach to government, altering the entire health insurance structure of the 85% of Americans who do have health insurance for the sake of the 15% who don't, with a labyrinth of often incomprehensible regulations that cost a king's ransom to enforce. Thomas Jefferson said it best. In a statement often attributed to the author of the Declaration of Independence, he said, "A government big enough to give you everything you want is a government big enough to take away everything you have."